Hello, my name's Carole Roberts. I'm the Principal Psychosexual Therapist and Service Lead for Share Psychosexual Service. Share equals sexual help and relationship enhancement. We sit within the Sexual Health Service for Blackpool Teaching Hospitals Trust, and the Psychosexual Service covers the geographical boundaries of both Lancashire and Blackpool, and we will accept referrals from those areas. The purpose of this video is to support you as a referrer to help your service users have a smooth pathway into psychosexual therapy. We are based at Accrington, the Acorn Centre. That's our single point of access, so all referral information and the team sit at Accrington Health Centre, but we have satellite services across the geographical boundary that I mentioned earlier. Psychosexual therapy is sex and relationship therapy. We are predominantly an adult service, but we can, in certain circumstances, see young people of the age of 16 to 18 if they need education about sex, simple and non-complicated assistance with sexual function, or indeed if they're struggling with their gender identity, because we can support you as referrers for them to transition across to specialist gender identity services going forward. We deal with couples and individuals to address issues of sexual function and also relationship issues. Issues that people will present with will either be functional or they will be issues around their sexuality identity, their gender identity, or maybe some sexual behaviours that they're engaging with that they're unhappy with. For example, compulsive sexual behaviour. We do not see clients who are sexual offenders. We do not address sexual offending behaviour, and if somebody presents to you requesting help, it would be a forensic sexology service that you would need to refer them into. Referrals are received primarily from GPs. GP referrals can be direct, so where a client presents to their GP requesting help and the GP refers directly into psychosexual therapy. Or they could be indirect GP referrals, and for example that would be somebody, say a female with sexual pain issues, may come to the GP, she's referred into gynecology for investigation and exploration, and the gynecologist then feels it's appropriate that she's referred on for psychosexual therapy. So that would be classed as an indirect GP referral, and that would be accepted by the service. If we receive referrals from other agencies, we will suggest that you ask your service user to go to their GP to get a referral through to us. Their other pathway through might be through a sexual health service. Sexual health services, because we sit within the same teams, can refer directly into us. So your service user would need to go through sexual health or GP to get a referral into us. If anybody has any questions and wants further information or wants to just talk about a potential referral with us, if you just contact the office on 01254 283333 and ask to speak to one of the therapists, we will have a conversation with you and help support you to either refer in or maybe to help with signposting for your service user to go to a more appropriate service. So for clarity, we do not accept self-referrals into psychosexual service. There needs to be a referral in. If we do have a client who contacts the service to make a self-referral, we will support them to get either the GP or sexual health referrals so that they can be seen with us. We do run an appointment system only, and the clients will be contacted and work with the administration team in the service so that they have a seamless transition into the service, but also they have regular appointments with their therapist. The service is commissioned for 8 appointments per episode of care. But that means that clients can be with us for over 6 months once they commence therapy. And the reason for that is that we give appointments with roughly a 3-week interval between appointments, and that's so that clients have time, not feeling pressure, to engage with any homework that the therapist may give them, so that they can make progress throughout their time in therapy. As the referrer, the service will liaise with you at all times. The first contact that we will have with you is we will acknowledge receipt of referral. Obviously, if you're sending sensitive information in about a client, a service user, you will want to know as the referrer that the information has been safely received by Share. We may not then contact you for the rest of the time the client's in therapy, but we will always contact at discharge, and we will send you a discharge letter to give you an overview of the outcome of therapy and the progress that the client's been made. If we do need to contact you in the interim while the client's in therapy, then we will do so, and usually this is for reasons of safeguarding, concerns about mental health, if we need some more investigations or examinations, we will keep in touch and we will work in a multidisciplinary fashion. The referrals can come in a variety of ways to the service. I would prefer if you could use our referral pro forma. If you don't have one, if you contact the service again on the number that I gave previously, we will email that out to you. And the reason for this is because the referral pro forma will give you prompts of the information that we require for accepting your service user into therapy. Some of the most important things for the service are that you ascertain the client's preferred method of contact, and the reason for this is that often service users don't tell their partners that they're coming to see a sex therapist, and what we need to do is make sure that we do not compromise your patient in any way by sending a letter when they would prefer no mail to go to the home address, and then the partner opens that letter, because we don't know who we're sending the letter to and what the home situation is like, and we wouldn't want to put anybody at risk. So information like preferred method of contact is really important, and then we can put our flags on the system and make sure that we follow the actions that your service user require. Information is on a need-to-know basis, so if there's anything that you feel we need to know from a risk perspective, and that might be a risk that the client poses to themselves, to others, or indeed risks that they may pose to the therapist and the psychosexual team, it's really important also, please, that is captured on the referral pro forma. If you do not have a referral form to hand, we will accept a referral via letter. You can either post the letters into the single point of access at the Acorn Centre, or you can email it in. We have a bucket email that we have limited access to, that the admin team work to receive referrals. If you email a referral in, we will be emailing out the discharge letter, and that will be a password protected document when it comes out to you. The referral pro forma will capture whether or not you prefer the letter to be by mail or by email. So again, please complete all elements of the referral form so that we can make sure that we are supporting you and your preferences as a referrer into the service. It's also important to note that once your service user completes therapy with the psychosexual service, that they are not able to be re-referred within a 12-month period. If you can therefore have a conversation with your service user before referral, just so that they are aware of that, and that might give them an opportunity to assess whether this is a good time for them to come into therapy, whether they indeed want to come into therapy, and if they are coming in, that they start thinking about their commitment to the 8 appointments that they're going to be offered, so that they get the best opportunity to address the issues that you've referred them in with. So that's the end of this video. If you have any other questions, please do not hesitate to contact the office. There's a leaflet on the website for you as referrer that captures all the information that I've talked about. There is also an up-to-date copy of the referral form for you as well. Thank you.